Good afternoon, everyone. My name is Heather Augustyniak. I'm a lead nurse practitioner for the Survivorship program at Baptist MD Anderson Cancer Center. Today, I'll be hosting the Life After Cancer Patient Education Series. We're happy to welcome Becky Ness, our oncology social worker at Baptist MD Anderson Cancer Center, who joined our practice in December of last year. She came from Northwestern up in Chicago, Illinois, where she also was an oncology social worker there. Becky, I'm going to let you talk about this important topic, coping with body and intimacy changes. Please take it away.
Everyone, thank you so much for listening to this presentation. I'm excited to talk to you about some things that maybe aren't always discussed as you are transitioning to life after cancer. And then it's how do we cope with the body and intimacy changes that have happened through your treatment, and then now that things have kind of resolved maybe a little bit and left us asking, what next? So to start off, what exactly is body image? So body image is how you see yourself, and this could be either mentally or when you look in the mirror. And body image can change over time. And it can also influence your self-esteem, which is how you value and respect yourself as a person. So being diagnosed with something like cancer can not only have a direct change on your body image, it can then also impact your self-esteem. And our body image can change through cancer and cancer treatment by a lot of different ways. Some common changes that occur from cancer are scars from surgery. A lot of folks undergo procedures such as mastectomies or lumpectomies, as well as other surgeries. Maybe you needed to have a hysterectomy or an ostomy or nephrostomy tubes placed. Those scars can kind of live on your body then. You may still be experiencing hair loss or chemotherapy or radiation, and that takes some time sometimes to come back. There may also be some changes in the shape of your body. For example, if you have lymphedema, the size of your limbs gets much larger due to the lymphatic fluid that builds up. And also your skin can change. A lot of times we see this from radiation where it could be red or itching or just a lot more sensitive to the areas that were treated. And these changes that we're talking about on this slide and the next one can sometimes be temporary changes, meaning that the further you get out from treatment, the better the side effects or the changes become, such as the skin changes and the hair loss. But some of the other changes that we're talking about may be a little bit more permanent or have a little bit more of a lasting effect and take some more time to reconcile, or may always be a part of you from now on. Some additional body changes that a lot of our patients experience from cancer is weight changes. Either they have weight gain, that can happen through the use of medicines such as steroids that maybe can stimulate that appetite, or people aren't as active as they used to be while on cancer treatment, so they gain some weight that way. Or on the flip side, they may have lost quite a bit of weight. As we know, cancer treatment can impact our appetite. A lot of folks experience nausea or other GI symptoms that can impact their ability to take in food. So that is a common thing that can happen. I think one of the hardest ones for folks to kind of cope with or handle is muscle weakness or fatigue. And so your body has obviously gone through a lot through cancer treatment, and a lot of times it's an unseen battle. But your body is busy at work fighting cancer, and so it's going to take a lot of time for that fatigue to get better as your body is kind of transitioning into this post-treatment phase. And as a part of that fatigue, again, we're not so active, so our muscles become weaker. Another significant change that isn't often discussed is changes in your sexual functioning. And this includes everything from loss of sexual interest, erectile difficulties, vaginal dryness, infertility, menopause, or the muscles in your pelvis area becoming a lot more weak throughout, depending on the type of treatments that you've had. So these are all very common body changes that can happen from cancer, but that doesn't mean that they're easy changes to live with or to cope with. And so we're going to talk a little bit about what are some ideas and how do we cope with these changes, and then move on to discussing more about intimacy. So what is the impact of all of these body changes on you as a person? For some people, changes that are more visible can make you feel uncomfortable, looking at the reflection in the mirror and you don't look like yourself. And so I think the biggest takeaway from this talk will probably be it can take time to process and move forward from these effects. Unfortunately, there's not always a quick fix. It's more about learning to cope during this time, and it's going to be a process. But changes that are more visible kind of can lead to some more increased feelings of depression and anxiety because you do have to see these changes on your body. However, that doesn't mean that there won't be feelings about your body, even if there are no lasting physical changes. If your body is able to bounce back from treatment, or you don't have some long-term changes, that doesn't lessen your experience or the impact of what you've been through on you. And these body changes can really influence your ability to or desire to be with your partner. And that's where the intimacy piece comes in here. That the way our body changes can impact our comfortability with being intimate with our partner, and that can impact our feelings as well. So some negative feelings or impacts of these body changes is, losing confidence in your body and its abilities, or feeling that your body has let you down or that it's weak or vulnerable. I think a common thing that a lot of our patients say is, I did everything right. I ate well, I exercised, and I still got cancer. And that feeling that your body let you down, or your genes let you down. And so that can really put you into a negative thought space that then in turn can lead to negative behaviors. And when we're talking about negative thought spaces, that's when we're not able to see or stop the thoughts from going to that bad place or that worst case scenario. Everything has that negative edge to it. It can really impact your ability to be comfortable with yourself. And these negative thoughts can, as I said, spiral into negative behaviors where you may end up avoiding social or intimate situations where you will be around people that maybe you don't know as well, people outside of that circle of folks that you do have that trust with. And so that can lead to negative self-esteem, isolation, and depression. Something that can be the hardest is when we do have those more visible changes is, what are other people going to think about us? What are they going to say? Are they going to say anything? Are they going to stare at me because I am missing a limb from cancer treatment? Maybe you need an amputation to deal with some a disease, or that you chose not to do reconstructive surgery, which is totally fine. And maybe you're concerned about wearing a swimsuit, to the pool or the beach. Or maybe you do have some lymphedema and swelling, something that's more noticeable. And people may look at you a little bit longer when it is, but oftentimes it's because they're curious and they're not trying to upset you or make you feel like like you're at the zoo or something like that. So a good tip to trying to maybe minimize the anxiety that can come out with being in public when you're coping with some of these changes, or can some of the feelings of uncomfortableness, is prepare responses internally for yourself to different situations, so that if you are asked an uncomfortable question, you can have a response there at that time, and so that you can kind of either play it off or provide some education or just like nip it in the bud. Kind of having these prepared responses can make you feel more control and maybe a little bit more confidence, and have gradually getting back into things you did before, like work, sports, and hobbies. We can't control other people. We can only control our reaction to those people. So I think kind of coming up with a mantra and some responses to what you perceive people may ask you can help you feel like you are more in control of your situation. But that's not to say that these body changes are all negative things. What are some positive things that we could take away from the impact of cancer treatment on your body? For one, it can make you just more aware of things. You can be more in tune with what feels good or not good and just be able to kind of better advocate for yourself. Maybe you're feeling stronger because you did it. You got through the treatment. You went through surgery or chemo or radiation and you recovered and you're so much stronger for that experience. Perhaps you're feeling more energized and motivated to treat your body well. I think it's really hard because we don't always do the things that we should: eat right, exercise, sleep 8 hours a day. And maybe going through this maybe helps you be, again, more aware of your body and be able to treat your body well. And hand with that is appreciate your body for what it does. The human body is an amazing thing. When it's all said and done, there's a lot of cool things that happen within that. So let's appreciate it for what it is. And I also think that in our society, we really tie a lot of our body into looks, and that in turn gives us a feeling of value. And maybe this can help tease that apart a little bit, that our looks don't make us up for who we are as a person, and kind of maybe take some of the societal pressure off of you a little bit. So all that said, it can be really hard to keep a positive body image through all of this. What can you do, or things that you can try to promote a positive body image for yourself? So one thing that you could try is working on learning to love every part of yourself. As I said, it's a process and there's no perfect way to do this, and there's no perfect body either. I think going back to the previous slide, honoring everything that your body has been through and how strong it is, and learning to love that part of your body and that strength, and that your body does do a lot for you. I think a hard thing that a lot of our patients who are post-treatment is they want to get back to who they were before and what you did before. And that's not to say that that won't happen. It just might be that it might take a little bit more time to do that. So you really need to focus on the present and set realistic expectations for yourself based on who you are now, and with the long-term goal of being back to where you were before. But that might take time, especially if there is fatigue involved. So it's really working on being present in what you can do based on today. An analogy that a lot of therapists use is like teaspoons of energy. You only have so many teaspoons before you run out. So really making sure that what activities and people are getting your teaspoons are really going to fulfill you and be realistic. You don't want to wear yourself out too fast. You might want to try trying to get back into some of those activities on an abbreviated scale. Still go for walks, but maybe let's hold off on that 5K for a little while. Or maybe there's a new activity. Maybe you got really into yoga or meditation, and trying new things or getting back into a previous activity can help you feel more positive and confident, which then also impacts your body image or your view of yourself. And it also gives you something fun to do. And if we feel like we're kind of living in a space where we're not able to find ways to, or we're struggling to find ways to apply these ideas to your life, sometimes working with a therapist is a really great option. They can kind of help you find these tools and work on with you and finding ways to promote this positive body image and try to get out of that negative thinking sphere. So what are some takeaway points for how do you cope with body change? As I've said before, and I'll say it again in this presentation, you need to give yourself time. You have been through a traumatic experience. And so you need to grieve the changes in your body, and you need to grieve to a degree the life that you had before. And you need to adjust to your new body and heal from the treatments. And even though maybe cancer has changed how you can do some things, that doesn't change who you are as a person. You still are you at your core, and you still have maybe have discovered some hidden strengths that you didn't know about. Or maybe you discovered a great support system you didn't know about, or something along those lines. You are still you no matter what cancer has done to you. I think being around people who support you, such as your partner, your family, close groups of friends or coworkers, people that are going to help build you up versus pulling you down a little bit. And then the common thing is hard to do, but eating well, getting enough sleep and exercise can really help improve your mood, reduce fatigue, and give you strength. So that's a great way of coping with some of these changes, is to just take better care of your body. However, we'll have the caveat that you should always check with your doctor before starting a new exercise routine. You don't want to push it so far and end up doing some damage. So make sure that you are working close with your physician. If you're able to embrace humor, that's really great. There's a whole thing called laughter yoga that does big belly laughs, because laughter has many positive effects on the mind and body. So if we're able to find some humor in things, or at least stay calm and kind of try to keep an even mind space, then that will maybe help you in coping or being able to handle these changes that have happened in your body. Another great resource is talking to other cancer survivors. How did they cope with these body changes? What tricks did they do to kind of feel more like themselves again? They're the best resource for you because they've been through something similar. It may not have been the exact same type of treatment, but maybe they did something very similar. We do have some support groups in the area. There's also peer support programs. That could be a great resource and value to you. Something else to consider is maybe talking with your doctor about your concerns. And I think sometimes this can be a hard conversation because you don't want to feel uncomfortable or feel like you're vain or anything like that. But I think it's a great idea to talk to your doctor, because maybe there's some options that, medically that could help with body image. Maybe there's another surgery, if you're willing to do that, to reduce scars or rebuild tissues, to help you feel more like your body reflects yourself. So it's always a good idea to talk with your physician. So how does body image impact intimacy? So there are different types of intimacy, and oftentimes when we think about that word, we think about sex. But intimacy is more than just sex. There can be intellectual, spiritual, experimental, and emotional intimacy on top of physical intimacy. And for this purpose of this talk, we're really going to look at emotional and physical intimacy and the impact of body changes on that. So when I say emotional intimacy, what does that exactly mean? And emotional intimacy is a closeness between two people who feel safe and secure with each other. It's sharing your deepest feelings, insecurities, and dreams without feeling judgment. It's having you feel valued and understood by your partner. And this is achieved through vulnerability, equal communication, and trust. And it helps create a sense of security within yourself and an ability to be wholly yourself and be authentically true. So when we go through something like cancer treatment, it can really impact our emotional intimacy with our partner because there's so much stress, anxiety, and depression that happens during cancer treatment that sometimes that intimacy takes a backseat. So some tips to improve emotional intimacy with your partner is maintaining an open dialogue and really work on showing empathy for one another. It can be very easy to become defensive, especially if the conversation is going into an uncomfortable place, but working on being empathetic, and that is really like hearing what someone is saying and being able to put an emotion to what they're saying can really help keep that open dialogue and really improve the connection between the two of you. And that's involved through engaged listening and both partners taking the time to be the listener as well as the responder. So it's not always one person doing the listening and one person talking, taking equal turns. And don't fear the conflict. I think a lot of times we shy away from that, right? We don't want to cause problems. We just want to kind of move forward. But that can really impact your intimacy with someone because it keeps the wall up. You need to discuss issues and create healthy boundaries versus avoiding. Something else to improve emotional intimacy would be to be vulnerable. And again, can be an uncomfortable place to live, right? To be raw and open and share your deepest fears and concerns with someone. However, if you are able to be vulnerable with your partner, that signals a lot of trust in them. And in turn, that they can trust you to be vulnerable as well. And as similarly with fearing conflict, avoiding being vulnerable or avoidance is the nemesis of intimacy. That guarding your feelings and not discussing your thoughts can actually distance you from your partner. It keeps things a little bit more superficial. And instead of trying to bring you together and have you guys be on the same team. And these aren't easy things to do. This comes with a lot of conversation and practice. It's also something to improve, to help improve intimacy emotionally is expressing yourself. That is to show your love and appreciation without fear. Maybe it's giving compliments or reminding your partner of why you love and appreciate them, and then them expressing that back to you, perhaps. And that expressing yourself can deepen that connection that you have with your partner. Again, caring for yourself. Sometimes there's some individual work you need to do within your coupleship. Sometimes these fears or anxieties need more one-on-one attention than the coupleship does. And so if you're feeling stuck or unsure, therapy can help you find a starting place. This can feel a little daunting doing it on your own. And so individual therapy and or couples therapy can be a great place to start these conversations. And how do we become emotionally intimate again? Knowing everything that you've gone through as a patient and as a caregiver, how do we come back to being the couple through this and facing this new aspect of your life? And these are tips to try to achieve that. But if we're feeling stuck or unsure, a good therapist can help you with that. And something else that to consider or try is making plans for intimacy. And I know a lot of folks sometimes don't like this. They want intimacy to be spontaneous or just happen. However, if you make plans and block out time to create a safe space where you guys can have these conversations or do something for each other, can really help intimacy grow too. Sometimes we need to do those date nights or those coffee runs together to be able to create a space where you can express some of these difficult thoughts or be vulnerable so that intimacy can then continue to grow. So body image can also impact physical intimacy. And there's a lot of common difficulties that patients, male and female, experience. For men, a big thing that impacts physical intimacy can be erectile dysfunction, which can also relate to loss of confidence or loss of sexual desire, anxiety, depression, and infertility. For women, pain during intercourse, early menopause, a loss of confidence or sexual desire, anxiety, depression, and infertility. So a lot of times the physical and the emotional can be really tied together, and our emotional state can impact our physical intimacy. If we're feeling anxious and depressed, we don't physically want to be intimate with our partner sometimes. So what are some tips or things to do to try to improve that physical intimacy? And the biggest thing I think for this portion is to get educated. There are often options available from a medical professional that can help improve physical intimacy. Some things that prevent physical intimacy, such as erectile dysfunction or vaginal dryness, those concerns or questions can be addressed at BMDA here with our sexual health clinic. We have one for both men and women. And they can and the providers that work in those clinics can prescribe maybe some different medications and techniques to improve the physical sexual health functioning. So maybe once we can get the parts working again, in a sense, or improving the working of those parts, then maybe some of that confidence will come with it. And then we won't be so anxious to be physically intimate with our partner. So it's all really kind of entwined. But I think the sexual health clinics that are offered really are a great starting point if you are looking to improve physical intimacy and you are struggling with the physical side effects or the physical impacts of cancer treatment on your body. Another tool or thing to think of is redefining sex. What does sex mean to you? You know, physical intimacy and sharing love with your partner doesn't always have to lead to a penetrative sex or even an orgasm. If we have pain with penetration because of vaginal dryness, or, you know, we're not able to get an erection to have penetrative sex, that's okay. Let's redefine sex into a concept or a thing that works better for the couple. And there's ways to improve connection, such as sensual touching, like massaging, naked cuddling, kissing, oral sex, things that may not bring you to orgasm, but can be very intimate and really improve the physical connection between the partners. And then also, while you're doing some of these non-penetrative movements, or you're doing some of this connecting, sensual touching, naked cuddling, really tune into the erotic sensations and be present. I think a lot of times we're very good at multitasking, where you're, you know, being intimate, but you're thinking about the laundry or all the things you got to do, and you kind of check out a little bit. Really making a attempt to stay present and mindful during these moments, and kind of really just focusing on your body and how you feel, and what feels good and doesn't feel good. And then also being attuned to your partner, what feels good for them and what doesn't, can really help redefine intimacy and redefine physical intimacy and sex for you, and still be very fulfilling, even if it doesn't lead to some of the societal norms or what they tell you what good sex is. Good sex doesn't need to be penetrative. It doesn't need to lead to an orgasm. Those are great too, but there can be a lot of ways to be physically intimate without that. Something to kind of maybe help is relaxation techniques. So if we're starting to get back into being physically intimate with a partner, that can be very anxiety provoking. Maybe it's been a while. Maybe you're not sure how you'll like being touched anymore. Maybe you tried and it really didn't feel comfortable to you, and so you're really anxious about this next time. So one exercise I like to give to patients to help relax not only your mind but your body as well before is the 4-7-8 breathing. That's a deep breathing exercise where for the 4, you breathe in over the 4 seconds. You do it quickly and deeply. You hold your breath for the 7 seconds, and then you release very slowly and precisely your breath for over 8 seconds. And you focus on that feeling of in and out. And you do this as many times as you feel like you should before you kind of feel maybe some calmness kind of come over you. And the whole goal is, once we're able to relax a little bit, then our muscles aren't so tense. So maybe that physical touch is more enjoyable, but also then maybe that calms your mind too. So we're not focused on so maybe some negative thoughts coming in, then you're able to be more present and mindful. A great tool to use with your partner is what we call body mapping. That's when you use the outline of your body. You want a front side and a back side, and color it according to how you would like to be touched. So like the green is like, it's like a stoplight. Green is yes, go, you know, touch me here anytime. I really enjoy that. And yellow is sometimes. Maybe I like this, maybe I don't. You can try it, but we may not be able to always touch that area. And red is a full-on nope, stop, I don't want to be touched here at any point in time. And so this might be really good to kind of do with your partner, just so that they know that they are touching you in ways you want to be touched, and that they're not pushing you in a way that you're not ready for physically yet. And we can see a lot of times this body mapping changes over time, especially once you're moving through past cancer treatment. There might be some situations where because of surgery scars or healing from radiation or whatnot, that you are more yellow and red in some areas. And then maybe we kind of over time go to a little bit of green there. A yellow becomes a green, a red becomes a yellow. So it's something maybe to always, to try with your partner if you're struggling with where you like to be touched. Your partner can't read your mind, and unless your body map is fully green, they won't know not to touch you in that way, especially that if you like to be touched differently before cancer treatment to now. So this is good education for yourself and for your partner, and what kind of touches are okay, and having these ongoing conversations as you move through survivorship or post-treatment life is good, so you can, as things change. So improving intimacy overall, don't rush the process. Good things take time. There's no specific blueprint to improving intimacy. It's really best to have these conversations with your partner and be open to the fact that it may move back and forth, and that's okay. There may be some days where you can be really vulnerable and open with your partner, and other days that's really hard to do. That doesn't mean you're backsliding. That's just where you're at for that day, and that's okay. Similarly, for physical intimacy, there might be something that feels really great and is green one week, and then it's a yellow or a red next. As your body is healing and changing, and as your mind is healing and changing, we expect to have a few ups and downs with things. However, if it seems to really be wildly up and down, or having more downs than ups in the relationship, or you're really struggling to even get started to become reconnected, then I strongly encourage couples counseling. I think couples counseling is great because it gives you that third party who has no vetted interest in you. They're not your friends or your family. They're kind of that neutral party that can really help the two folks in the couple be able to find that way to reconnect or be able to listen to each other. So what are some signs that you could use that level of assistance, either individually or within your couple? Because you don't want to leave your house, because you don't want people to see you, you don't want to date or meet new people in the community, you are avoiding touching, being affectionate, or having some sort of physical intimacy or sex with your partner. You won't undress, and you don't want to undress in front of them. You don't want to let them see your scars. You feel ashamed because you have cancer, or you've lost or gained a lot of weight, or you feel really kind of stuck on who you were before cancer versus who you are now. And who you are now can be really great. You just need to be able to see that. So if you find that any of this is really hitting home for you, it might be worth doing some individual or bringing your partner in to do some kind of couples counseling to help you guys get to a better point individually or together. So how do you go about doing that? Well, at BMDA, we have a lot of resources here. So I encourage you to speak with your medical team, your primary oncologist or surgical team, and ask them to place referrals for you. As I mentioned earlier, we have a men's and women's sexual health clinic that can help improve and manage the physical sexual health symptoms. As well as social services. That's the department I belong to. We have 4 different social workers in the building that can help provide emotional support, education, and resources to help with overall coping. And they can connect you with other counselors in the area that really focus on maybe some of these intimacy issues or couples counseling to make sure that you're seeing the best provider for you. If there are any questions that pop up or you want to explore further, I'm certainly available. My name is Becky. I am a licensed clinical social worker here at Baptist MD Anderson, and I am certified in sexual health education and therapy. And you can reach me at my email, rebecca.ness@bmcjax.com, or by phone at 904-202-7313. And if I'm not the right person to talk to, I'll certainly connect you to whomever you need. Thank you so much for spending this time with me today, listening to me ramble on this lovely topic. And I hope you have a great rest of your day.